Environ Life Science Limited, partnering for life.
I am Dr. Vivek Mehta, better known as Dr. Poppy. My clinic name is Dr. Poppy Dental and Facial Aesthetic Clinic. I am based in Ahmedabad, Gujarat, India. Today I am going to talk about dental implants. Dental implants are widely available in India, and the country has been significant advancement in dental implant technology and expertise over the years. India offers a range of options for patients seeking dental implants, including both domestic and international implant brands. Some of the popular implant companies in India that includes Ostium, Noble Biocare, Straumann, Zimmer Biomet, Simpladent, and whatnot. Dental implants have emerged as a game changer in the field of dentistry, revolutionizing the way missing teeth are treated. In India, the popularity and demand for dental implants have been on the rise, owing to the advancement in dental technology and growing awareness among the population. This small titanium posts are surgically inserted into the jawbone, providing a stable foundation for artificial teeth, or involves several stages, beginning with a thorough examination and treatment planning. Through advanced imaging techniques such as CT scans, dentists can assess the conditions of the jawbone and determine the optimal placements of the implants. Under local anesthesia, the dentist creates an incision in the gum tissue to expose the underlying jawbone. Then, using specialized instruments, they carefully drill small holes to accommodate the implants. The implants are precisely positioned and secured in the jawbone, allowing osseointegration to take place. Osseointegration is a crucial process where the bone fuses with the implant, providing a solid and long lasting foundation. After the implant placement, a healing period of several months is necessary for osseointegration to process. During this time, the jawbone gradually integrates with the implant, ensuring its stability. Temporary prosthetic options such as dentures or bridges may be used to restore functionality and aesthetics during the healing period. Once osseointegration is complete, the restorative phase begins. Impressions of the implant sites are taken to fabricate custom made dental crowns or prostheses that will be attached to the implant. These restorations are meticulously designed to match the natural space, color, and alignment of the patient's remaining teeth, ensuring a seamless and natural looking smile. Now, the cost of dental implants in India can vary depending on several factors, including the type of implant, the number of implants required, the complexity of the case, and the expertise of the dental professional, and also the location of the dental clinic. On average, the cost of a single dental implant in India can range from 30,000 rupees to 70,000 rupees, approximately 350 US dollars to 800 US dollars. However, it is important to note and prices may vary. One of the significant advantages of dental implants is their ability to restore the function and aesthetics of the smile. They provide a stable and long-lasting solution for patients with missing teeth, offering improved chewing ability, speech clarity, and overall oral health. Dental implants also have the advantage of preventing bone loss in the jaw, which commonly occurs when teeth are missing and can help maintain facial structure and integrity. However, it is essential to consider the potential disadvantages and limitations of dental implants. The implantation process requires a certain level of oral health and an adequate amount of healthy jawbone for successful integration. Patients with significant bone loss or oral health issues may require additional procedures such as bone grafting or periodontal treatment to ensure a favorable outcome. Dental implant surgeries also carry some risk, including infection, nerve damage, and implant failure, although these complications are relatively very rare. So, ideal candidates for dental implants in India, as in any other country, are individuals who have lost one or more teeth and have good overall oral health. Adequate bone volume in the jaw is crucial for successful implant placement. Patient should be committed to maintaining excellent oral hygiene practices and attending regular dental checkups. It's essential to consult with a qualified and experienced dental professional who can assess individual stability for dental implants placement. What are the dental implants offer now? I'm going to talk about the advantages of dental implants. First, improved aesthetics. Dental implants closely resemble natural teeth, enhancing the smile and overall facial appearance. Second, enhanced functionality. Implants restore proper chewing ability, enabling individuals to enjoy a wide range of foods without discomfort or restriction. Third, speech improvement. Missing teeth can affect speech clarity, but implants provide stability, allowing more clear and confident smile. Fourth, durability and longevity. Implants are designed to be long lasting with proper care and maintenance. They can potentially last a lifetime, making them a worthwhile investment. Fifth, bone preservation. Implants stimulate the jawbone, preventing bone loss and preserving facial structures. Sixth, convenience and comfort. Unlike removable dentures, implants eliminates the need for adhesives and do not cause irritation or discomfort. Seventh, improved self-confidence. Dental implants restore a natural looking smile, boosting self-esteem and confidence. In recent years, dental tourism has gained popularity in India, with international patients traveling to the country for affordable dental treatments that includes dental implants and cosmetic smile designing. India's reputation for providing high quality healthcare services at a fraction of the cost compared to many other countries has made it an attractive destination for dental procedures. So, in the conclusion, dental implants are widely available in India with various implant companies and treatment options to choose from. The cost of dental implants can vary depending on several factors, and India offers competitive pricing compared to many other countries. Dental implants provide numerous advantages such as restored functions, improved aesthetics, and preservation of oral health. However, there are also limitations and potential risks associated with the procedure. Ideal candidates for dental implants in India should have good overall oral health and adequate bone volume in the jaw. Consulting with a qualified dental professional is essential to determine individual stability for dental implants. So it depends on the skin type basically, or we see the previous pictures of the patient that what shade they have previously. We are going to choose the same shade and they are not costing. They all are on the same price value. For some sort of duration, it is the teeth will have some sensitivity or the migration problem. But after the teeth is fixed at one position, that sensitivity or the any other problem will resolve automatically. Thank you so much.